You're on.
Start this. Okay. Good afternoon, everyone. I'm going to do a presentation about a renal dialysis patient due to her end-stage chronic kidney diseases, and she happened to miss 5 sessions of dialysis when she came to ED at IDH. First of all, what is renal dialysis? It is a renal replacement therapy for end-stage renal failure patient, which is normally less than 15 eGFR calculated by CKD EPI method, and it could be used for both chronic and acute renal failure patient. Dialysis actually does not provide complete replacement of renal function. However, it actually gets rid of all the metabolic waste and electrolytes that gets accumulated inside the body and restores the buffering system and restore the pH of the body. It could be done through 2 processes. First one's a hemodialysis that is actually done by AV fistula for hand, and it's less invasive method. And second one's a peritoneal dialysis that is done by peritoneal cavity, and the doctors actually have to have a small surgery to establish that catheter inside the abdomen of a patient, and they normally do dialysis through that catheter every time they do the dialysis procedure. So it's got higher chances of infection because it gets exposed to different kind of bacteria every now and then, and it consists of really suitable temperature and environment for the colonization of the bacteria.
Can you tell me how you're doing that with the thing?
The magic touch?
That's not a touch screen.
It was.
A little bit about a hemodialysis machine. It consists of 3 main parts: dialyzer, dialysis solution, and tubing for transport of blood and dialysis solution. Dialyzer actually consists of a hollow chamber which consists of hollow fibers and parallel transmembrane plates, which acts as semi-permeable membrane through which all the electrolytes, solids and metabolic waste get passed through from blood to dialysis solution. And the basic principle of this machine is just diffusion of solids across the semi-permeable membrane on a countercurrent flow. Countercurrent flow means the blood and the dialysis solution move opposite to each other. It is basically just set up to maintain the concentration gradient between the blood flow and the dialysis solution, increasing the efficacy of the dialysis procedure itself. So potassium, phosphates, urea and other metabolic wastes get diffused into the dialysis solution. Also, the diastolate consists of sodium bicarbonate and glucose that diffuse into the bloodstream to maintain and restore the buffer system and to nourish the cells inside the body. Fluid removal is done through hydrostatic pressure gradient that is maintained by the hemodialysis machine, and it just creates a high pressure and a low pressure gradient from high pressure gradient the fluid moves into the low pressure gradient, which is just basically from the blood to dialysis solution, and they just get rid of the dialysis solution after they're done with the whole procedure. When a patient is in renal failure state, it actually disturbs the fluid and electrolyte balances inside the body. It causes metabolic acidosis, and with constant chronic insufficiency of the renal system and constant accumulation of fluid and constant electrolyte imbalances inside the body, it actually creates a micro-inflammatory system situation inside the body, which stimulates the production of oxidative stress, which then goes on to produce a lot of immune mediators and inflammation inside the body. It's just basically creating a whole lot of other problems. Electrolyte imbalances. When a patient is in this state, our major concern is about the sodium-potassium pump and the calcium channels, which are essential for the action potential for the conduction of the impulses inside the body. And the major concern about this disturbance of these channels is in our heart and in the nervous system. In our heart, it's really important to keep the rhythmic myocardial contraction, which is very necessary to pump the blood into our lungs and the other organs. So if there's any imbalances in sodium-potassium pump, it actually starts misfiring or not firing at all and not conducting any impulses, which could cause arrhythmias, heart block, and various other cardiovascular problems. And in the nervous system, it is very necessary for the neurotransmission of neural impulses, and imbalances in any of those could cause not conducting any impulses at all, or seizures, or neuropathy, neuropraxia, which is just the temporary loss of motor or sensory system. Next one is hyperkalemia. It's which is high potassium levels in the serum. It is mainly because of metabolic acidosis that is caused due to the renal failure. To actually compensate it, potassium keeps coming out of the cell to compensate the balance of charges, and just gets accumulated in the serum since it's not getting excreted by the renal system, and it just creates a situation of hyperkalemia. Hyperphosphatemia, it is basically because of decreased excretion and calcium phosphate precipitation due to the combination of calcium phosphate. Hypomagnesemia, and the other major one is the hypercalcemia. It is because renal failure patient cannot synthesize the more active form of vitamin D, which is 125 dihydroxy vitamin D, and the enzyme that is necessary to produce that vitamin D from a regular inactive vitamin D is produced by kidneys. So when the kidneys are down, the renal failure patient cannot produce that enzyme, and the active vitamin D, which is very necessary for the absorption of calcium ions from the GI tract, is not present in the patient, so which basically creates a situation of low calcium, and with another organ that is associated with this whole mechanism is parathyroid gland, which senses low calcium ion in the body, and you start producing parathyroid hormone, and this whole mechanism creates a situation of secondary hyperparathyroidism, and this is very complex and could cause osteomalacia and bone deformities in the long run, as parathyroid hormones creates calcium ion from the bone to actually increase the levels of calcium in the blood. So it is very necessary for the renal failure patient to give active form of vitamin D to stop this chain. Another main disorder that caused due to renal failure is the acid-base imbalances in our body. Kidney are extensively involved in homeostasis and pH balance in our body, and it's just basically done through that formula, and this side here is done through kidney, and that one's from respiratory system. So kidney basically get rid of the hydrogen ion and constantly synthesize hydrogen carbonate and ion, and keeps the balances between those and cations and the anions. However, in renal failure patients, kidney is not able to excrete as much hydrogen ions as it should be, and just cannot resynthesize hydrogen carbonate and ion as much needed. So it just creates a big anionic gap in between that cation and anion state, which basically just accelerate the muscle wasting and protein catabolism, creating poor nutritional status of the cells. When a patient is in this stage, you can actually see them breathing really, really fast to try and get rid of this carbon dioxide from the respiratory system to try and balance it. But the impact of the renal system is so high that it doesn't get restored as much as it needs to be. Okay, This case is about a 45-year indigenous female who is on hemodialysis for 3 times a week, and it has been known that she missed 5 sessions of dialysis when she was away to Tiwi Islands to attend a funeral. And it has been known that she was in an end-stage renal failure, which was secondary to hypertensive nephrosclerosis, and she was on dialysis via left forearm AV fistula. When we looked back at her history, she had a history of hypertension, hypophosphatemia, secondary hyperparathyroidism, renal anemia, and she was overweight with BMI of greater than 30, and she has been recently diagnosed with endometrial hyperplasia, which is unrelevant in this case. When she came to ED after those missed dialysis sessions, the symptoms include mild fluid overload and with stable vital signs. However, the investigations were quite severe with peaked T waves and widened QRS on ECG, which is basically the sign of hyperkalemia. Severe metabolic acidosis that was seen in blood gas analyzers. Interstitial prominence on chest X-ray. I'd say that because it's got some kind of infection which is still not investigated, and hyperkalemia, raised inflammatory markers, low hemoglobin, and severely elevated creatinine. This is the UNE result. This one here is the result of the first dialysis, before the first dialysis session, after 5 missed dialysis sessions. And just look at that creatinine level, which is 37, that is quite high, and the potassium level of 8.7, which is considered as a medical emergency. More than 6.5.
So that's a record.
Yeah. This is just basically the UNE results after the couple of sessions of dialysis. This one here is her creatinine level went down to 708 and her potassium went down to 4.0, and her EGFR calculated through CKD EPI method is 6, which doesn't look too bad. It looks normal. Well, looks on the target range of a renal failure patient. CMP results, just have a look at that phosphate there, which is 4.87, that is quite high. If she was even a week late, the consequences might have been different. Even if the phosphate levels are quite high, her calcium levels are quite normal, so that's a good thing. The full blood count results would only interested on the hemoglobin count, which shows that it's constantly anemic, and her hemoglobin count is quite low always. Parathyroid hormone. This result shows that the first one that was taken on March was 108, and the doctors have been doing the parathyroid hormone test every month. That indicates that she's been under close supervision of the doctors, and they actually managed to get it down to 44 and 56, which is not too bad. But doctors normally aim it for 3 to 4 times of the normal reference range, so it's quite okay at the moment, because it is very crucial to monitor the parathyroid hormone to actually maintain the calcium and the phosphate metabolism inside the body and the whole chain. We want to actually monitor that very closely, and this patient actually managed through a couple of dialysis sessions according to the missed dialysis protocol, and she was put onto a 5-day course of augmentin. I think it's because of the interstitial prominence that was seen on her X-ray, chest X-ray, and she was provided with the education about the serious consequences of missing multiple dialysis sessions, and she was put onto queue for outpatient renal clinic review in 2 weeks, so as per hemoglobin levels. This is just a quick list of current medication. We're mainly concerned about that one, which actually controls the phosphate levels inside the body, and the next one's calcitrol, which is active form of vitamin D, and methoxypolyethylene glycol erythropoietin, which is basically just a form of erythropoietin, because her kidneys won't be able to synthesize any, and you need to actually give it to the patient every week to keep her bone marrow to producing red cells as much as they need, and the rest of them are just hypertension. Okay, how did she end up with dialysis? What's the basic mechanism behind it? It is because she's been having chronic kidney disease. What is chronic kidney disease? It's irreversible progressive deterioration of renal excretory system, resulting in replacement therapy or renal transplantation. The basic stimulants that could cause chronic kidney disease in long term are diabetes, hypertension and hyperglycemia, obstructive nephropathy, unresolved drug toxicity. That one day most of the time causes acute renal failure and sometimes only causes chronic kidney diseases and could be inherited too, like polycystic kidney disease. And most of the renal failure patients, those two are the main culprit. These are the most common ones. It's just a basic diagram of pathogenesis of chronic kidney disease. One of the stimulants that we just talked, or the other condition that actually kills the nephrons, and when the nephrons are just less than half the number, the kidney tries to adapt by hyperfiltration, increasing the RAA system, that is just renin aldosterone angiotensin system, which basically just increases the GFR of single nephrons and increases the glomerular permeability. This actually could, the increased permeability of the nephrons lets the proteins and macromolecules to pass through, which is basically pathological and could cause into proteinuria. This could actually cause inflammation and kidneys try to remodel all the nephrons and stuff, which causing in fibrosis and just decreasing the GFR, decreasing urine output, and systemic complication. It is basically just the severe chronic kidney disease, or regarded as the end-stage kidney failure. This is basically just a quick diagram. What you get when you're in chronic kidney failure. You get anemia because of less erythropoietin production, cardiovascular diseases because of imbalances in sodium-potassium channels and calcium metabolism. And the main one in cardiovascular disease that we're concerned about, LVH and LVD, which is left ventricular hypertrophy and left ventricular dysfunction, which is very good method to actually follow up with a hemodialysis patient, because they actually follow them up with ECG, and it's very noticeable in ECG. And so an early diagnosis and treatment could be undertaken for such patients. What is the significance of the chronic kidney disease and missing dialysis sessions? It could be life-threatening sometimes. It is very important to maintain the hemostasis to sustain the life, prevent other organ failures. Dialysis actually has been shown to increase the life expectancies of the renal failure patients, and has been somehow proved to improve the quality of life of the renal failure patients. With all the advantages that could come with some disadvantages with the procedures of dialysis, there has been documented cases of medical errors during the procedures, like vascular-related problems, excess blood loss, failing to monitor BP and other vital signs, and the main ones, the bloodstream infections, which could cause septic shock and sometimes could be fatal if it's severe. differences, and that's all. Any questions?
Well, that was excellent.
Very good.
I'm staggered.
Straight,